Hello, I'm Dr. Maurie Markman from City of Hope, and I wanted to discuss with you very briefly an incredibly interesting paper. Actually, it's sort of a little bit of a, it's kind of a niche type of a question, but one that is so commonly asked within oncology, and we sort of didn't have answers to it, or we had a lot of opinions. And the question is, if you have a patient with a known, metastatic lesion at a large bone, and you're concerned about that bone, it's not been fractured or anything, should you prophylactically radiate it? Because obviously they may break it and have a problem. They may never break it. And the last thing we want to do is be going around and radiating all kinds of lesions. Not only is that inconvenient for the patient, there's certainly a cost associated, but radiation has its own effects, particularly if you were going to then come back and have to radiate again, or maybe use chemotherapy, etc. So what is the value of a prophylactic radiation of what one might call high-risk, asymptomatic bone metastases? And the study that I'm noting here was recently published in the Journal of Clinical Oncology, entitled Prophylactic Radiation Therapy versus Standard of Care for Patients with High-Risk Asymptomatic Bone Metastases, a multi-center randomized phase 2 clinical trial. So this study actually only had 78 patients in it. There wasn't a large randomized phase 3 trial, but I would suggest that the answers about as definitive as you need to get. Some people have actually labeled that, these are pragmatic trials, meaning this is an important question to kind of answer at the clinical level. There's no new drug, there's no new approval, we have the radiation equipment. But what is the value? So 78 patients in this randomized trial. Here's the bottom line. At 1 year, a serious skeletal event, as they had defined in the trial, occurred in 1 of 62 bone metastases, that's 1.6%, in the patients who were radiated, versus 4 of 49 bone metastases, or 29%, in the standard of care arm. So that's statistically significant, and you can certainly say, well, not only there was certainly a benefit because they didn't develop a serious event, but in addition, at a follow-up of 2.5 years, overall survival was significantly longer in the patients who received radiation. Again, that's a little more difficult to know definitively because obviously the population was very small. But in addition to all of that, risk of hospitalization was substantially less. In fact, there were no hospitalizations in the patients who received radiation versus 4 hospitalizations in the patients who didn't receive radiation. Again, the numbers are small, but clearly the indication suggests that if you're concerned about the risk of a fracture, patient having to be go to the hospital, patient being immobile, and therefore, potentially running the risk of developing a deep venous thrombosis, pulmonary emboli, etc., there's a value in radiation, even in the asymptomatic setting, if there's a high-risk bone metastases. I think a very interesting study, very much along the lines of what I consider to be a critically important pragmatic trial answering a clinical question. And I congratulate the authors, the investigators, for conducting this study. In my opinion, it answers a critically important question that I think has been relevant for my multiple decades of clinical practice. And I thank you for your attention.